Thanks so much for taking time out of your day. My name is Dr. Brian Wu. I'm a medical director at HMSA and a pediatric pulmonologist or lung doctor. The past month has been extremely difficult as our state, along with the rest of the country, has been hard hit by another wave of COVID-19 infections, this time led by the Delta variant. So what exactly is a Delta variant of COVID-19? This is an illustration of the virus that causes COVID-19. The name of the virus is SARS-CoV-2. Those red projections that you see are called protein spikes, and mutations in these spikes are what causes nasty variants. The reason why these protein spikes are so important is that they are the main reason why we are having a pandemic. In order for the virus to infect humans, they have to get into our cells. Imagine that these spikes are like keys, and certain cells in our body have door locks on them. This COVID-19 virus has a unique key that is particularly good at opening the locks into our cells. The Delta variant has an even better key. It's like the key to the front door of my house. I need to kind of jiggle it to get the key in, while my wife's key fits smoothly. The Delta variant is the COVID-19 virus that developed multiple upgrades to the spike, such as spring-loaded action, better shape that fits the hole. This allows the virus to get into our cells that much easier and faster. So what made this variant? Well, unintentionally, anyone who gets infected makes variants. Once the virus opens the lock to our cells with its protein spike key, it enters our cells and uses us to make more of itself. It does this by releasing instructions called RNA, which you could think of as a book of recipes, which our own cell's kitchen line uses to cook up a bunch of COVID-19 viruses. These viruses our cells were forced to make, then go out to infect other cells. Every time our cell makes new batches of the virus, they can make it perfectly correct, but with each cell it infects, there's a chance that our cell's kitchen line makes a mistake and makes a virus that is different. These mistakes can make the virus better at making us sick, and this is exactly what happened with the Delta variant. So every opportunity to keep someone from getting a COVID-19 infection reduces the chance of a variant that could be even worse than the Delta variant from emerging. So hopefully that explained one reason the Delta variant is infecting humans so easily, but there's more to it than that. Dr. Rochelle Walensky, a well-respected infectious disease physician, is the director of our nation's Center for Disease Control, or CDC. She has stated that this COVID-19 virus is one of the most infectious viruses seen in her career. We already discussed how easily this virus infects us, especially the enhanced and Delta variant. But the upgrades in the Delta variant spike also make it better at hiding from our immune system. This picture shows the timeline our immune system takes to protect us against an infection. For generic infections, such as the common cold, the first responders of our immune system, called the innate immune response in green here, get activated within hours. Think about it like having a fire extinguisher easily available to respond quickly to a fire. This innate immune system early response also triggers an alarm. So if the infection isn't taken care of, the cavalry comes in. Think of it as the fire department coming in. This later response is called adaptive immunity. If you've never been infected by a specific virus before, adaptive immune response takes about 6 to 10 days to start working. The COVID-19 virus, and especially the Delta variant, is particularly good at evading our immune system. So it takes longer for the early responders of our immune system to respond, and this leads to a delay in calling the big guns or adaptive immunity to come. Unguarded, the virus can freely attack early on, which is shown in the purple line here. by an early fast rise in concentration of virus in our body. One study showed that those infected with the Delta variant had 1,000 times greater concentration of virus early in their illness compared to those infected with the original strains. This can overwhelm our body and cause severe disease. The Delta variant is so much better at infecting humans, it took just a few months for it to basically become the only COVID-19 variant spreading in our community. This Hawaii Department of Health graph shows what portion of COVID-19 variant was circulating in our state. You can see the Delta variant popped up around June, and by mid-August, practically all of the COVID-19 infections were due to Delta. This pattern is similarly seen in the rest of our country. To show off my Microsoft Paint skills, I drew this illustration to really highlight how contagious Delta variant is. With the original strain, each infected person who isn't isolated would go on to infect on average 2 to 3 other people. And each of them would go on to infect 2 to 3 other people. So after 3 rounds, one person infected with the original strains of the virus ended up infecting 15 or 16 other people. With the Delta variant, one infected person would infect 6 people. So after 3 rounds, one infected person with the Delta variant went on to infect 216 people. This is our state data again. On the left is April 1, 2020. Each bar that you see represents confirmed COVID-19 infections per day. When the Delta variant surged in August, we're seeing over 1,000 people infected per day some days. This is more than triple what we were seeing in earlier surges. This is why our hospitals are currently stretched so thin in our state. So much so that we've begun conversing, what do we do if somebody who needs a hospital stay can't get care? Who would we prioritize? Severe COVID can also destroy your lungs. This is why we're hearing about the possibility of running out of oxygen in our state. We also know that COVID-19 is not just a disease of the sick and elderly. This is why there are heart-wrenching stories of young, healthy people succumbing to the virus. The people of our state have been pummeled by this virus. All of what I've just said is probably not completely new to you, and the things that we can do to get things better won't be new as well. But I hope I'll be able to explain not just what we can do, but why. So remember earlier on, I explained that the COVID-19 virus, especially the upgraded Delta variant, is so nasty because it can evade our naive immune system. Well, the whole point of vaccinations is to upgrade our immune system so it isn't so naive. The entire purpose of a vaccination is to teach your immune system about a foreign invading virus so that when it sees the actual virus, it responds much swifter and aggressively. Think about it as adding a fire sprinkler and patrolling fire trucks that will keep a fire way less likely to spread and burn down the building. Remember, this virus spreads in the air through respiratory droplets, so it will most likely first land in your nose or throat. If you're vaccinated, sure, there's a chance some of the virus can still infect your cells in your nose and throat. But severe COVID-19 infections occur when the virus has time to spread from your nose and throat to your lungs. This is why we see most people end up hospitalized after a week or more of getting infected. If you are vaccinated, your trained immune system will way more likely prevent this spread from occurring than an unvaccinated individual with an untrained immune system. Data suggests that the vaccines are also better at training the immune system than previously being infected with the original strains of the virus. That's why vaccinations are recommended even if you've had COVID-19 before. So yes, even with this despicable Delta variant, fully vaccinated people are 5 times less likely to get infected and more than 10 times less likely to end up hospitalized or dying from this virus. Next, I'll go over just a few of the many common questions people may have. First is, why do people who are vaccinated still need to wear masks? Since when before the Delta variant surge, they were told that when a vaccinated person is around another vaccinated person, they didn't need to wear a mask. So breakthrough infection is when someone who is vaccinated gets infected. There's no vaccine that 100% guarantees a person won't get an infection. But before the Delta variant, the COVID-19 vaccines were over 90% effective at preventing infections. However, during the Delta variant surge, we're seeing more breakthrough cases. So even though being vaccinated makes it less likely to get infected and way less likely to get severe disease, we know that because someone without symptoms can spread COVID-19, and we're seeing more breakthrough cases with the Delta variant, that's why masks are being recommended. But you got to wear the masks properly. So if you want any kind of guidance, just Google CDC Guide to Masks, and it'll go over what a proper mask is. In this graph, the red line represents patients who are unvaccinated and got Delta variant COVID-19 infection. The green line are those vaccinated with a breakthrough infection. What this is showing is that vaccinated people that get breakthrough infections with the Delta variant can start out with as high a concentration of virus as someone unvaccinated, shown in the top left of the graph, but they clear the infection faster, shown by the green line dropping down earlier and faster than the red line. So mask up so we can get past this Delta surge. Remember that masks and vaccinations are just two of many things that can reduce the chances of getting infected. There's a Swiss cheese metaphor that some people have used to explain this better. Think of every preventative measure, such as physical distancing, quarantine isolation, masks, good ventilation, as slices of Swiss cheese. There are holes in each slice, but they are located in different locations. So if you overlap a bunch of slices, you reduce the chance the virus will get through the holes. The red arrow in the middle also shows a rodent eating at a slice. This pest is when misinformation occurs, such as completely inaccurate statements that appropriate masks cause harmful effects on your breathing. This leads to unfortunate less mask wearing and a loss in this layer of protection. If you don't like cheese, you can use window screens with holes in them as the analogy, and rust in the screen as misinformation. And yeah, in case you're wondering, I was just using this to show off my Microsoft Paint skills again. Another common question about the mRNA vaccines is whether they can change someone's DNA. Remember, RNA is like a recipe for our cells to make proteins. On the right is a picture of how mRNA vaccine works. In the vaccines, the mRNA holds the recipe for this protein spike and only the protein spike, not the whole virus. Our cells use this recipe to make the spike, which cannot cause infections by itself. But when our immune system sees these spikes, it memorizes it. So if it sees it again, it knows how to attack it. It's kind of almost like training a dog to sniff for explosives. It trains our immune system to sniff for the COVID-19 virus. mRNA vaccines have not been used in humans before, but has been researched for decades. When we had SARS almost 20 years ago, this virus was in the same coronavirus family as the virus that causes COVID-19, which is why it's called SARS-CoV-2. And the SARS virus also had protein spikes. So vaccines were being pursued for SARS, and we actually used all of this research to develop our current COVID-19 vaccines. So you can actually say all of the research for mRNA vaccines were for the purpose of a pandemic like this. mRNA vaccines are easier to make and you can adjust them easily if the virus changes where the vaccines don't work anymore. And also, don't worry about the mRNA recipe in the vaccine causing indefinite production of the spike protein because mRNA is super fragile. It gets destroyed quickly. So basically, the mRNA vaccine teaches our immune system and leaves shortly after. Finally, mRNA is not DNA. Think of DNA as the cookbook for our body that is written in a language different from RNA. Our DNA is kept locked up and separate in a part of our cell called the nucleus. The reason why scientific experts have continued to explain that mRNA vaccines won't cause changes in human DNA is mRNA would have to somehow get into the nucleus, then get translated into the language of DNA, then somehow get inserted into the DNA cookbook. This doesn't happen. A very recent important question is concerns of getting vaccinated in people who are thinking of having a baby or are pregnant. The American College of OBGYNs, or ACOG for short, which is the medical society for doctors that manage fertility and pregnancies, has strongly stated that anyone pregnant, planning to be pregnant, or lactating, go get vaccinated. Despite what the friend of a cousin of a celebrity tweeted, there is zero evidence or reason why the vaccines would cause infertility. There's also no evidence vaccines causes harm in mothers or fetuses. There have been at least over 158,000 pregnant individuals who have already reported being vaccinated. Contrary to that, there's evidence that protective antibodies in vaccinated mothers are actually passed on to the fetus or to breastfed babies. And with all of these infections during this Delta variant surge, we are seeing many more pregnant mothers with severe disease because being pregnant is in itself a risk of having more severe COVID-19 infections. Crushing stories like this mother who died shortly after giving birth and other stories that we've unfortunately heard of locally may be preventable with vaccinations. Over the last several months, people have been asking about the risks of heart problems associated with the mRNA vaccines. There is almost no decision in the universe that is all benefit and zero risk. So our brains are constantly weighing benefits and risks. An incredibly rare, significant adverse effect seen primarily in males under 30 years of age that received mRNA COVID-19 vaccines is something called myocarditis and pericarditis. Our heart have a lot of muscles called myocardium. Our heart is also encased in a sac called the pericardium. Inflammation of the muscles or the sac is myocarditis and pericarditis respectively. Why the vaccines cause this in certain people is not clear, but we believe is an uncommon immune response. And we've actually seen myocarditis in non-mRNA vaccines and in some medications. So I really want to emphasize this next point. If someone gets COVID-19 infection, they also have a risk of getting myocarditis. And this risk is actually 6 to 34 times higher than the risk of getting myocarditis from the vaccination. And to convey a message from one of our well-respected cardiologists in our state, unlike the myocarditis that can be seen related to a COVID-19 infection, which can be devastating and long-lasting, the myocarditis associated with the vaccines are generally mild and transient with recovery without treatment. Finally, in the history of vaccines, almost every significant side effect was seen within 2 months. Your risk for myocarditis after vaccination does not continue to increase over time. On the other hand, your likelihood of being hospitalized from COVID-19 does increase over time if you are unvaccinated. These graphs depict this. For example, on the left, for every million doses of vaccine given to a male 16 to 17 years old, it is projected we would see 73 cases of myocarditis due to the vaccine. Because the vaccines aren't going to cause myocarditis way after being vaccinated 1 year out, we'd still only expect 73 cases. However, for every 1 million doses of vaccine given to a male 6 to 17 years old, after 1 year, we would have prevented 1,540 hospitalizations due to COVID-19, some of which may have led to severe long-term complications or even death. This is why the American Academy of Pediatrics, which I belong to, has also been advocating that everyone eligible for being vaccinated, which right now includes those 12 years and older, go get vaccinated. For all these reasons I have previously mentioned, vaccinations are the safest path to ending this pandemic. Another very popular question is regarding whether or not someone should get a booster shot. First, a clarification. A booster shot is for someone who got the full primary vaccine series, which is 2 doses for the Moderna or Pfizer vaccines and 1 dose for the Johnson & Johnson vaccine, and their immune system responded sufficiently. However, over time, their immune protection wanes and isn't as good. This is very different from an additional dose, which is for those people whose immune systems did not sufficiently respond after the primary series. As of today, September 19, 2021, the only additional doses that have been approved are for those moderately to severely compromised immune systems. This includes those actively on chemotherapy, on medications to suppress their immune system because they've had transplants or other medical conditions, and those who have a disease that directly impairs their immune system. If you may be in this group but are unsure, talk to your healthcare provider managing your condition. Booster doses have not yet been approved. Just last week, an advisory group of experts to the FDA unanimously recommended a booster dose for those 65 years and older and those at risk of severe COVID. However, the FDA hasn't approved this yet. Again, the only data that they reviewed was for the Pfizer vaccination. This advisory group actually voted against booster doses for the general population because they wanted to wait for additional safety data for booster doses in younger age groups and also data to see if younger age groups and those without high risk needed a booster to prevent severe disease. On September 29th, another advisory group called the Advisory Committee on Immunization Practices, or ACIP, is going to give recommendations to the CDC. So the FDA is charged with regulating vaccines, including safety and efficacy data, while the CDC is the one that's responsible for establishing how vaccines should be used in the population. So the CDC also takes into account how much disease is going on in the community, the cost of the vaccines, and the issues with implementing vaccines. So it's still to be determined whether everyone needs a booster and who needs a booster. Finally, there have been questions and comments about being medically exempted from the COVID-19 vaccination. There is one absolute contraindication to getting a COVID-19 vaccine. It's if someone had an anaphylactic reaction to the first dose of a COVID-19 vaccine or an immediate allergic reaction, immediate meaning within 4 hours of exposure, to a previous dose of the COVID-19 vaccine or a component of that vaccine. Some people may have spoken with their medical provider very early on when there is less information about the vaccine and were told, hey, maybe don't get the vaccine yet. If this is the case, more likely than not, their provider may have new information to share with them, so they should talk with their provider if it's been a while. There is not one prominent medical association out there that is recommending against COVID-19 vaccinations when given as indicated. Just as people would want the top medical provider caring for them when they are gravely ill, you would trust these top providers with your life. Trust them now. They're all recommending COVID-19 vaccination when given as indicated. There's been a lot of talk about, go do your own research. And some folks out there may say, I did my own research. I read about, some type of side effect that's not being reported. Our country has implemented the most intense vaccine safety monitoring system in its history. And it's being very transparent about these side effects. So sometimes when folks are doing their own research, there may be misinterpretation of the data that's out there, leading to incorrect conclusions. For example, if my friend ate a lau lau for the very first time in their life, then 1 week later he had a heart attack, one might conclude the lau lau was the cause of his heart attack. This is the same logic as saying someone got a COVID-19 vaccine. 1 week later, they had a heart attack, and then concluding the vaccine must have been the cause of the heart attack. People get heart attacks. Just because they ate or did or got something before the heart attack doesn't mean that caused their heart attack. In our modern world of healthcare, we use a principle of evidence-based medicine, which involves trained interpretation of scientific information. We actually saw this in action when the FDA advisory panel reviewed didn't recommend booster vaccinations for the whole general population, but just for certain populations. The science helps us determine what is just a random coincidence versus a true adverse event or true benefit. I hope there is some information here that was beneficial to you. It is human nature to trust someone we know and respect more than trusting a stranger. Empowering trusted messengers by educating them so they can spread accurate health messages is crucial. There's a saying I like, no snowflake in an avalanche ever feels responsible. We are all in this together. The way for us to kind of get out of this pandemic is really to know the correct information so that we can make that best risk-benefit determination when we choose to do things like don't go out in huge crowds, wear masks when we're outside or around people that are in our household, or to get vaccinated. Mahalo for taking the time today, and stay safe.